My name is Laney McMath, and I'm from San Antonio, Texas. I've lived here for about the last 8 years after retiring from teaching overseas and also retiring from the United States military. About 4 years ago, I needed to seek assistance because of a cataract in one eye, and I knew I was going to have cataract surgery. And I ultimately came to Focal Point Vision, and my eye was operated on by Dr. Maverick. And at the time he operated on that eye, he says, we do have the traces and elements in the other eye that are going to require, of course, at some point in time, that you have cataract surgery then. And so I knew it was inevitable that it was going to happen. And so a little over a year ago, I happened to notice an ad in the paper that said that Focal Point Vision was doing a study on cataracts with certain parameters, namely that an eye hadn't been operated on before, and also that you fell within a certain age range. And so I answered the ad and asked Dr. Maverick to evaluate my eye that was going to need surgery, and he did. And I was accepted into the study that has lasted now a year. And it's been most helpful to me. And of course, Focal Point Vision has been right there on the spot all the way through with every single one of the milestones that had been set. And the staff have been, fantastic. And every step along the way, I've had the confidence of Dr. Maverick and even Dr. Burkhart, who've been working together since Dr. Maverick did do the second surgery. And so I've been most pleased with the outcome of the study. My vision was, of course, I wore glasses, and I've worn glasses and I've worn contact lenses ever since I was a young boy. So I knew that my vision was deteriorating, and you don't really know how bad your vision might be until you have your first cataract surgery, because you discover that there's one eye which is very, very clear and light is very apparent, as opposed to the other eye, which seems to have a brownish haze. And so then you recognize the difference, and you can say almost, oh boy, when can I have the other eye done also? But they won't do it too early. It has to be at a certain stage before Dr. Maverick would operate. And luckily enough for the study, I fell within that range. And I've always suffered from nearsightedness, and also at later stages in life, of course, because of a great deal of book work and reading work, have had to use reading glasses. And I had to give up contact lenses. I had worn 2 or 3 different types of contact lenses over the years, then went back to glasses. And after I had gone to glasses about 5-6 years ago, just as I was retiring, I was told that I was going to need cataract surgery, that it was becoming more and more apparent. So after I came back here, I sought out Dr. Maverick here at Focal Point. I recommend all sorts of people to come here because of the nature of the staff, what they cover with you, and the people who are genuinely a part of the whole situation that you come into when you come to Focal Point, because they are most helpful and courteous and always willing to give you any sort of an answer, even if you just call on the phone. Really and truly, they do. It's been a pleasure to me to be associated with them. And that's the reason I do recommend Focal Point to other people. And I do have some friends who have come here. So I'm most pleased.